Good day everyone, I'm Daniel May Opamonag, a Level 2 nursing student from Bicol University, Pulangi, and today I'll be discussing a serious but rare labor complication called the umbilical cord prolapse. We'll go over its causes, symptoms, diagnosis, and how it's managed during delivery.
The umbilical cord is a vital structure during pregnancy. It connects the baby to the placenta and provides oxygen and nutrients, while also removing waste products. The cord contains 2 arteries and 1 vein, all protected by a soft substance called Warden's jelly, which helps prevent it from getting compressed. Now, what is umbilical cord prolapse? It's a condition where the cord slips through the cervix into the birth canal before the baby does. This can lead to the cord getting compressed, which cuts off the baby's oxygen and blood supply. Although rare, it's a serious emergency that usually happens just before or during labor. There are 3 main types of cord prolapse. Overt prolapse happens when the cord slips out after the water breaks and can actually be seen or felt in the vagina. This type is usually the most obvious and urgent. Occult prolapse means the cord is compressed but hidden next to the baby's presenting part. It's not visible and is usually detected by abnormal fetal heart patterns. Cord presentation refers to the cord being between the baby and the cervix before the water breaks. If the membranes rupture, this can turn into a full prolapse. The pictures on the screen shows how these types differ. There are several factors that can increase the risk of umbilical cord prolapse. Let's go through them one by one. First, premature rupture of membranes, which means the water breaks before labor starts. Without that cushion of fluid, the cord can easily slip down past the baby. Next is polyhydramnios, or too much amniotic fluid. This extra fluid gives the cord more room to move around, increasing the chance that it might come down before the baby. Premature babies, especially those born before 37 weeks, are smaller and don't fill the uterus as much. This creates space for the cord to fall past them. Multiple pregnancies, like twins or triplets, also increase the risk because of the extra movement and shifting of positions inside the uterus. Another important factor is breech or abnormal fetal position. If the baby isn't head down, there's more room for the cord to slip through the cervix. Lastly, a long umbilical cord naturally has a higher chance of slipping down due to its length and flexibility. All of these situations can make it more likely for the cord to drop ahead of the baby, which can lead to serious complications if not managed quickly. One of the earliest and most important signs of umbilical cord prolapse is a sudden drop in the baby's heart rate. This happens because the cord gets compressed, which limits oxygen flow to the baby. Monitoring the fetal heart rate is often how this condition is first suspected. Another key symptom is if the cord is visible or can be felt in the vagina, especially after the membranes have ruptured. This is a clear and urgent warning sign that immediate action is needed. Mothers may also notice a change in the baby's movement. The baby might move less or suddenly stop moving altogether. This can indicate that the baby is in distress due to reduced oxygen. Overall, umbilical cord prolapse is considered an emergency during labor, and it requires quick recognition and fast medical response to prevent harm to the baby. Cord prolapse is diagnosed through a vaginal exam, where the cord might be felt. It can also be confirmed by fetal heart monitoring, which may show a slow or irregular heartbeat. Sometimes, an ultrasound or changes in the mother's blood pressure can help confirm the diagnosis. As for management, this is a true emergency. The most common and safest solution is an emergency C-section. While preparing for surgery, medical staff may reposition the mother, usually in a knee-chest position or Trendelenburg position to take pressure off the cord. Manually lift the baby off the cord. Give the mother oxygen and the baby's heart rate will be closely monitored throughout. If the umbilical cord gets compressed for too long, the baby may not receive enough oxygen, which can lead to several serious complications. The first is brain damage. When the brain doesn't get enough oxygen, even for a short time, it can affect the baby's development and lead to long-term neurological problems. Next is fetal distress, which refers to signs that the baby is struggling, usually shown by an abnormal heart rate. This is a warning sign that the baby isn't getting enough oxygen. In the worst-case scenario, if the prolapse isn't treated quickly, it can lead to stillbirth, which means the baby dies before or during delivery. But the good news is, if cord prolapse is recognized and treated right away, usually with an emergency C-section, most babies recover fully without any long-term issues. For the summary, this slide shows a simple flow of how umbilical cord prolapse happens and what it can lead to. It often starts with a triggering event, like the water breaking on its own or being broken by a doctor, or when the baby is in an unusual position like breech or transverse. These situations create more space for the cord to slip down. Next is the descent of the cord. With the loss of protective amniotic fluid, the cord can fall into the birth canal, especially when the baby hasn't fully moved into position yet. Then comes cord compression. As the uterus contracts or the baby moves down, the cord gets squeezed between the baby and the cervix or pelvis. This blocks blood flow and oxygen from reaching the baby. Over time, this can cause fetal hypoxia, which means the baby is getting less oxygen, and acidosis, which is a buildup of acid in the baby's body due to lack of oxygen. Because of all these risks, this condition requires an emergency response, usually a fast C-section, to protect the baby from serious harm. In conclusion, while umbilical cord prolapse is rare, it is a serious obstetric emergency that requires quick recognition and immediate action. Early diagnosis and prompt management can make the difference between a life-threatening situation and a safe delivery. Thank you for your attention.